Macrogol or macrogols is a laxative, taken to treat constipation, difficulty pooing. You can also use it to help clear a build-up of hard poo in your bowel, which can happen if you've been constipated for a long time. Faecal impaction. It can also be given before a colonoscopy, a test to check inside your bowels, to empty your bowels before the test. How to use. Dosage for constipation. The amount of macrogol intake depends on how bad your constipation is. Ask a pharmacist for advice if you are not sure. The usual dose for constipation for adults and children aged 12 years and over is full-strength powder sachets. Contains around 13 of macrogol. One sachet taken 1 to 3 times a day. Half-strength powder sachets contains around 6 grams of macrogol. One sachet taken 2 to 6 times a day in divided doses. A ready-to-drink solution. One sachet taken 1 to 3 times a day. Liquid 25 ml diluted in 100 ml of water, taken 1 to 3 times a day. The usual dose for sachets for constipation for children aged under 12 years, pediatric sachets, is 6 to 11 years, 1 sachet taken twice a day, up to 4 times if recommended by a doctor. 12 months to 5 years, 1 sachet a day, up to 4 times a day if recommended by a doctor. 1 to 11 months, half to 1 sachet a day. Children under 12 do not need to take all of the drink at one time. They can take half in the morning and half in the evening. Dosage for fecal impaction. A doctor will tell you if you have fecal impaction, and they will advise you on how much macrogol to take. The usual dose for fecal impaction for adults and children aged 12 years and over is full-strength powder sachets, contains around 30 grams of macrogol. For sachets on the first day, they increase by 2 sachets a day to a maximum of 8 sachets a day taken in divided doses. Half-strength powder sachets contains around 6 grams of macrogol. 8 sachets on the first day, then increase by 4 sachets a day, up to a maximum of 16 sachets a day, taken in divided doses. The usual dose of sachets for fecal impaction for children, pediatric sachets, is 5 to 11 years, 4 sachets on the first day, then increase by 2 sachets a day, to a maximum of 12 sachets a day, taken in divided doses. 12 months to 4 years, 2 sachets on the first day, then 4 sachets a day, 2 for days, then 6 sachets a day for 2 days, then 8 sachets a day. 1 to 11 months, half to 1 sachet once a day. Who may not be able to take macrogol? Macrogol is not suitable for some people. To make sure it's safe for you, tell doctor or pharmacist if you have ever had an allergic reaction to macrogol or any other medicine, have had a hole or breakage, perforation in the wall of your intestine, have ever had a blockage in your intestines or paralysis of the intestine, for example because of intestinal surgery or severe infection, have ulcerative colitis, Crohn's disease, or a rare condition called toxic megacolon, need to add thickeners to liquid to help you swallow them, are being treated for heart failure or an irregular heartbeat. If you never take more than 2 full-strength sachets or 4 half-strength sachets in any 1 hour period, speak to your doctor about how much you can safely take. Have been told you need to follow a low salt or low sodium diet, especially if you need 3 or more sachets a day for a long time. Precautions. Some medicines, such as epilepsy medicines like levetiracetam or phenytoin, may not work as well if you take macrogol at the same time. For most people, one laxative will be enough to relieve constipation. Occasionally, you may need to take 2 different types of laxatives at the same time to get your bowels moving again. Only take 2 laxatives together if a doctor recommends. It is a small risk of getting side effects. Side effects. Common side effects. These common side effects of macrogol happen in more than 1 in 100 people. There are things you can do to help cope with them. Diarrhea, indigestion, stomach pain, rumbles or aches, bloating and twin, farting and burping, feeling or being sick, nausea or vomiting, sore bottom, anus. These side effects usually get better if you reduce the amount of macrogol or after you have had a poo. Talk to a doctor or pharmacist if these side effects bother you or do not go away. Serious side effects: severe diarrhea or vomiting, feeling more tight than usual, shortness of breath, swollen ankles, feet or legs, edema, muscle weakness, irregular heartbeat,